Once again, we are going to talk about abortion, ectopic pregnancy, and immoral pregnancy. Suppose you are a midwife or a nurse working in a maternity. So sometimes you can receive a client complaining vaginal bleeding. So if it is in early pregnancy, that is before 20 weeks of gestation age, then you must think of three diagnoses: ectopic pregnancy, molar pregnancy, and abortion. Once there is abdominal pain, you should exclude molar pregnancy and look for abortion and ectopic pregnancy. So ectopic pregnancy, remember, is of two types: ruptured and non-ruptured. If it is abdominal tenderness and uterus tenderness, you should consider ruptured ectopic pregnancy. So if it is a problem related to the cervix closure and product of consumption, you should look for abortion after use of speculum during physical exam. So let us start with abortion. We will continue with ectopic pregnancy and we are gonna continue with molar pregnancy. So start with abortion, then ectopic pregnancy, then molar pregnancy. So what abortion is? In on this diagram, you are seeing a baby. Those are the products of consumption. So abortion, it is defined as the loss of pregnancy before the age of viability, that is before 20 weeks of gestation age. So abortion to be managed should depend on types. So but before looking at types, let's first look for the cause. What causes abortion? Abortion means it is the loss of viability. It is the loss of pregnancy due to the age of viability. That is the age, gestation age less than 20 weeks of full, less than 20 weeks. And the abortion means abortion is caused by different, such as chromosomal abnormalities, reproductive organ dysfunctions, external trauma such as switch and hormonal imbalance. Remember that progesterone maintains pregnancy, so if it is not, it decreases during the first semester before 20 weeks of gestation age, till to the baby not protected well, leading to termination of pregnancy. Then chromosomal ability, if remember that for the baby to grow, there is a protein synthesis. If there is a destruction in protein synthesis, which starts from DNA, and the chromosome store that information. If that information is not stored, the baby should not grow well and grow abnormally, and this will lead to the termination of pregnancy, as baby is not growing well, and this may lead to termination of pregnancy. The other cause of abortion is external trauma. External trauma, for example, external trauma on the uterus. It may be environmental triggers. such as being heated or being naked by a knife. So abortion it may present an one with abortion may present an symptom such as vaginal bleeding, such as abdominal pain, such as endouterine bleeding on a spectrum. So when you use a spectrum during physical examination while you are in maternity, and you are seeing, you are noticing the vaginal bleeding from the you are saying that the uterus is bleeding. From uterus, their bleeding comes from the uterus passing through cervix into the outside. That is what you call in the uterine bleeding. The endometrium, which is the layer, we talk about the layers of uterus in the other video, is bleeding. So regarding this abortion, that is the sign and symptoms the client may present. So the diagnosis, the diagnosis of this abortion, you do FBC ultrasound, liver function test, because and the drain function test. Those are bad end to be eliminated out of the body. So regarding type of abortion, we have what we call inevitable abortion, threatened abortion. Let's come back. These are required products of consumption. So the cervix, in the threatened abortion, the cervix is closed, but in inevitable abortion, the cervix is open and the product of consumption is still there in the uterus. Missed abortion, the embryo is not there and the cervix is open, and the embryo is not there. No, brightened ovum, the embryo is not in the uterus. Missed abortion is that the heartbeat of the fetus not being here, being listened and by either Doppler or CTG. Then the other is inevitable abortion where cervix is open but products are still there. Incomplete abortion is when we have incomplete abortion, we have cervix open but there are remaining product of consumption in the uterus, as well as complete. So those are all they are already no remaining product of consumption in the uterus but the cervix is open. So you may, if cervix open early, you may do what we call cervical clearage. So it is a procedure done to close the cervix, and we will see the anatomy and physiology of cervix. But let's base on the three factors and the three type. So to manage abortion, you manage according to the type. So for example, abortion, for example, threatened abortion, you need the cervix is closed. So what you need to do is to maintain pregnancy. To maintain pregnancy, you should give progesterone 100 milligram BID or oral in 1 month, or 200 milligram BID, no 200 milligram. Well, you give 100 milligram TID and 200 milligram BID in 1 month. That is the progesterone dose. So for inevitable abortion, where there is product remaining in the uterus, as someone is having vaginal bleeding. This may lead to shock, and hence once the client is unstable, should get the hypovolemic shock first, and then you should do surgical management like MVA, and we will see the general nursing procedures step by steps you can do. We will start with nursing procedures, and then we will proceed with midwifery procedures. So and the same for a complete abortion. And the complete abortion, what if someone is complaining shock? You correct it first by giving IV fluid like a normal saline 0.9%, which is a isotonic solution, and we will talk about types of solution in the video later. So, and if a post-abortion, you give antibiotics like ampicillin or ampicillin and plus metronidazole. Ampicillin like ampicillin and gentamicin. So this dosage vary according to the countries. So the other is what you call ectopic. Remember, it's abortion complication include hypovolemic shock, anemia due to the loss, red blood cells are being decreased, and that is abortion. And the other is ectopic pregnancy. For ectopic pregnancy is when, remember we have the ovary of finger-like meshes of fallopian tubes and the uterus. So what you call ovary, what you call ectopic pregnancy is when the implantation is not in the uterus but in the fallopian tubes. Fallopian tubes are also called oviduct. So back 1 second on the transportation of the egg. When sperm combine with egg at the time of ovulation, where the egg is released in sperm, and the sperm combine with the egg to form zygote undergo multiplications, then it changes to 4 cells, 6 cells, 18, and so on. And once it is carried as a blastocyst, then reach the uterus, where it is implanted, and then become the embryo in the uterus. So ectopic pregnancy is when the implantation is not in the uterus but is in the fallopian tubes. So here what you complain is the endouterine bleeding on spectrum as sign and symptom, but causes of this is the chromosomal abnormality or external trauma, which may prevent the egg from reaching the uterus, and hence, or the blockage of the uterine walls, so the baby will remain in the fallopian tubes, or when the endometrium endometrium is not strong enough to protect the baby, or is weak enough. so it cannot accept the embryo. So ectopic pregnancy, once you do ultrasonography, you see a baby. Once you do ultrasound, you see a baby implanted in the fallopian tubes, and you diagnose as ectopic pregnancy. So the signs and symptoms include vaginal bleeding, abdominal pain, and tenderness. For ruptured, there is tenderness, and the Douglas tenderness of abdominal tenderness, rebound tenderness. That is when you place a finger and you release it, on abdomen release it, the client experience pain. So you manage ectopic pregnancy by reducing BCG levels. So you give a drug called methotrexate, and you give it if the mass is less than 3 cm on ultrasound. The BCG levels is less than 100, and you give it to the mother accompanying ectopic pregnancy. So the other is molar pregnancy. Remember, there are what you call trophoblast cells. Trophoblast cells are cells which make a placenta. A placenta is made in the final days of the first trimester, such as at the 14 day, 15. It is made in the first trimester. So trophoblast cells, when have anomalies such as anomaly may be caused by chromosome abnormalities, so as that is why methotrexate is given to prevent the rapid division of trophoblastic cells. Remember, those trophoblastic cells have the role of carrying the zygote from the ectopic pregnancy, the blastocyst from ectopic pregnancy to the uterus. So if the drug is used to stop the rapid growth of them. So that is in molar pregnancy also that occur. Molar pregnancy, the trophoblast cells grow rapidly and form what we call placenta. Placenta is there to protect the baby, and we will see what we call amniotic fluid and the prome and the preterm labor, as well as the other amniotic fluid disorders. So, but not in this video. For molar pregnancy, what you do is to do aspiration. You aspirate. Then aspiration is the management for it. Molar pregnancy. So the abortion, ectopic pregnancy, and the molar pregnancy are there, and here in maternity the lab investigation, and they include the FBC, liver function test, and function test, urinalysis to see if you have organ dysfunction. It's also for an FBC. It's also for ectopic pregnancy and molar pregnancy complication include I prefer